Human Services Committee to order. Madam Clerk, can we have the roll call, please?
Commissioner Marecki, Commissioner Daub,
Here.
Commissioner Anderson has requested to be excused. Vice Chair Colleen,
Colleen, here.
Chair McCormick,
Here.
we have a quorum present.
Next item.
Item B, Chairwoman's remarks.
So today we will have a tour of the morgue. So for all of those who are interested, please meet us shortly after this meeting. Next item.
Item C, approval of the June 14, 2022 meeting minutes.
Move approval.
It's been moved and supported. All those in favor? Anyone opposed? Any abstentions? Motion passed. Next item, please.
Item D, unfinished business, there is none. Moving to item E1 under new business, requesting commission approval of amendment number 2 to a 2-year contract with a 1-year option to renew with Black Family Development.
All right. This is our second amendment to this contract. Are there any questions from commissioners on this item? And we'll take all of these together as well. Yes, Commissioner Vice Chair Colleen.
Thank you, Madam Chair. Yeah, these are the quarterly updates for our CMOs, the usual balancing the budgets based on contact. So I will move items 1 through 4 on the main agenda, and I believe it's item 1 on the addenda for all 5 of those for approval today.
It's 5 and 6. Okay. All right, it's been moved and supported, and let's go through the items. Item number 2.
Item number 2, requesting commission approval of amendment number 2 to a 2-year contract with 1-year option to renew with CCMO Center for Youth and Families.
Great, that's another CMO. Is there any questions? All right, item number 3.
Item number 3, requesting commission approval of amendment number 2 to a 2-year contract with 1-year option to renew with GrowthWorks, Inc.
Questions from commissioners? Next item.
Item number 4, requesting commission approval of amendment number 2 to a 2-year contract with 1-year option to renew with Insight Youth and Family Connections, Inc.
Item.
We're now going to head to the agenda for item number 5. The agenda, item number 5, requesting commission approval of amendment number 2 to a 2-year contract with 3-year options. 3 contract with 3 1-year options to renew with Bridgeway Services, Inc.
Sure.
Yes, Commissioner Vice Chair Colleen.
Thank you, Madam Chair. Just for clarity, these contracts are 2-year contracts with 3 1-year options to renew. Just for clarity, we are in the first year still of the original 2-year contract. Is that correct?
As far as I know, that's correct, right? Okay. Go
Yes, Madam Chair. Melissa Fernandez, Division Director for Juvenile Youth Services. That is correct.
Okay. Okay, good. We're just getting going with them again. Excellent. Thank you.
Any other questions from commissioners? Nope. Next item.
Item number 6, requesting commission approval of a grant award with the U.S. Department of Health and Human Services, Health
Okay, this-
Resources and Services Administration.
On items 1 through 6, we have a 6th item. So
Yeah, Madam Chair, if I may, I moved the first 5 items, the amendments to the contracts. I didn't include number
Oh,
6
I
in
see.
that.
I see what you're saying. Okay. And I was going to take everything together, but if you
That's the
motion that
discretion of
way,
the chair, Madam Chair.
that's fine. So we'll go ahead and vote on items 1 through 5. All those in favor?
Aye.
Aye.
Oh, we do need support. I believe it was supported already by Commissioner Marecki. Okay. All right, it's been moved and supported. All those in favor, I think we had ayes. Any opposed? Any abstentions? All right, there are none. Motion pass. And item number 6, we'll go ahead and take.
Move for approval.
Support.
It's been moved and supported. All those in favor? Oh, you had a question?
Yeah, Madam
Go
Chair,
ahead.
just one question. I'd like to know what the trajectory is of the number of people that are coming to our FQHCs. Is that on the uptick? Is it staying the same? How are we doing with getting more folks into our FQHCs?
County Healthy Communities. Actually, we're seeing a resurgence this year. People are starting to come back out. We just had a board meeting last night. We're seeing growth in both primary care, behavioral health care. And now we opened and have fully functional 5-operatory dental clinic in Hamtramck as well as Wayne. And that just was effective at the start of June for fully operational. So we're seeing increased growth in those 3 primary care areas, as what I call primary care areas, but it's behavioral health, primary health, and then dental care. I don't have the exact numbers. It's probably in the range of about 10 to 12%, and dental is a lot higher. Unfortunately, the COVID vaccines have dropped tremendously because that's probably a good indicator because a lot of people have already been vaccinated, but the booster volumes are dropped down dramatically as well. So the pediatric vaccines we got in this week, so we'll be watching those closely. When I say the pediatric, I mean more the newborn up to 5 years old. So we're offering that, we're trending that. The other thing we're seeing a significant increase in is our outreach efforts, and what I mean by that is getting people help, helping them enroll in Medicaid, Medicare, as well as finding them other resources to assist them during the pandemic times. Hope that answers everything.
Yeah, and thank you for that, Mr. Coaches. Because I do know it dropped off during COVID.
Good.
With people coming back, are we seeing new people, or is it the people we already were seeing that didn't visit us during COVID?
It's curious you say that because we've been made an effort through our state organization, the Michigan Primary Care Association, to start calling people assigned to us through Molina, Meridian, as well as United Healthcare. And so we're making that effort. A lot of people that are assigned to you doesn't necessarily mean they get their healthcare. They still look to emergency rooms to get their primary care, to go in for their refills. So we're beginning to check daily, Monday through Friday, and obviously Monday's a little bit busier day, but we get a list of every one of our patients assigned to us that visited an emergency room in any area in the state. So it's making them aware, and it's also giving us an opportunity to tell them 2 things. They don't need to go to the ER to get their primary care, and they need to come see us to get their wellness care, so they don't have to visit an ER for their primary care at all. So it's a cycle, but we started working on that. And out of the people we contact, and we've been probably seeing around 8 to 10 a day, we probably get 2 out of that, or approximately 20% come in and make a visit. And so that is adding to our volume that we just spoke about a little bit ago. And then the people that were always getting their care for us are coming back. And then I'm adding in the dental program. And so we're starting to see a higher pediatric volume in the dental program as well.
Yeah, and we know it's better to go to one of your clinics for primary care than it is the emergency room for
Not just,
patient outcome.
not just our clinics, but all clinics. Stay at the ER so you don't backlog everything going on, and the cost of care gets risen dramatically with the use of the emergency rooms.
And one other thing I'd like to ask, Madam Chair, I know in the clinics, it's very important for the viability of the clinics, your mix of patients that those that do not have health insurance, those that have Medicaid, and those that have a more traditional health plan. How's your mix as far as that goes in your clinics?
Well, last month we saw a disturbing trend. We're hoping it was just a monthly analysis of it. Because the year-to-date trend has been impacted that much, but we saw a rise last month in our self-pays. I hate to call it like this, but I call them no pays because we're not in, we bill people, we're not a free clinic, but we don't collect, and we don't go after anyone in collections. That's part of our board's demands. And so no one goes to collections. So we have a discounted sliding scales for those patients. Based upon their income, our copays go down to $5 a visit, and we don't go after anyone. But on those particular patients, we're collecting 10 to 15 cents on the dollar billed. And we saw a rise in that. If that trend continues, it's disturbing because we can't offer all of our services. That's why we welcome the Medicaid patients and we try to get them insurance because we're getting some payments. And we're incentivized for our quality of care as well on those patients. So if we can keep them out of ERs, if we can get them immunized, we get some extra incentives along those lines.
So you're reasonably satisfied with financially in terms of the sustainability of the clinics?
Year to date, the payer mix is solid. I call it the payer mix. And so the difference is this last month, we saw some changes. So we want to watch that, because it wasn't a trend yet. It was just the month. And so we will look at the year to date. And when we have our next board meeting, we'll put the packet together in July and look at it again. Right now, yes, we're solid.
Thank you, Mr. Coaches. Thank you, Madam Chair.
Any other questions?
I have a question, Mr. Coaches, before you leave, in reference to the dental program. I believe we talked about having dental at both locations. Is that correct?
That's correct. We have 5 operatories at both locations, and we're partnered with the University of Detroit Mercy Dental School. They have 3 faculty members which rotate, and we train their dental students as well as their dental hygiene students.
Okay. And the capacity of that program, is it to the max or is it?
No, we still have some room for productivity there.
Oh, great.
So, I highly encourage all the commissioners. I know I've sent out my brochures before to everyone, I think. I don't know if you remember, but you got a virtual copy of those. If we need to send more over, we can do that as well.
Can you resend?
Yeah, we can
resend
resend
that for us?
I'll have that done within the next couple of days. And then if someone gets it and someone doesn't, that doesn't mean I have everyone's emails, but please share if you could, but I'll make sure.
If you can send it to our clerk and then they'll disseminate it to all of us and myself, maybe.
Make sure you get it.
All
I
right.
know that, and we'll go from there.
Thank
And
you.
I'll try to send it to everyone.
Okay.
Thank you.
Thank you. Right. So there was a motion on the table for to move this item forward, and it was supported, right? All those in favor?
Aye.
Aye.
Any opposed? Any abstentions? All right, motion passed. Next item, please.
Returning to the agenda, item F, such other matters as may be properly submitted before the committee.
There are no such other matters.
Item
Next
G, public comments.
All right, public comments. Are there any public comments on in the audience? We'll start. Is that Kavia? How are you? One of our youth council members. You want to come up and say a few words? No? Okay. All right. All right. Are there any comments or anyone online? No comments online and none on the phone. All right. All right. We'll move to the next item.
Item H, adjournment.
Adjourn.